And so I'm going to go through and explain the making of this serum so that you make it just as easy as we can. It's relatively simple to do. The reason we set it up this way is we have a word system on how to do it, but that gets confusing. So this is in pictures, and it really is pretty simple. So, using an 8 to 12-month-old mixed breed dog, 60 to 100 pounds. Why that age? For us, it just seemed that at that age, their immune systems were intact, they were functional. We made sure these dogs were not spayed or neutered animals, because spaying and neutering, which we'll get into later, interferes with their immune systems. We liked a dog between 60 and 100 pounds, because no sense doing this in a 10-pound dog, you didn't get enough blood. You needed to get as much blood out as you can, so you get 80%. So a 100-pound dog, 8% will give you about, what, 80 cc's? I'll get you more than that, give you about 250 cc's. You spin it down, you get about 110 cc's of serum. So you can only do this once. You can't do this more than once in any dog. Why is that? Because you get antibodies to the Newcastle's disease virus. You have vaccinated the dog to a chicken virus, okay? At this particular period of time, 8 to 12 hours, this is not a vaccine. This is an immune storm that you have created inside that dog. That dog has been shocked with a virus, and that immune system, if it's intact, is responding. And the response is incredible. So, do a full lab work, eliminate all possible health problems. You don't want a dog with heartworms. You don't want a dog with Babesia Gibsoni. You don't want a dog that's carrying any kind of an immune problem.
No
Vaccinate
heartworm.
against all diseases, so you're not coming in carrying something, because you're going to give this to a dozen dogs. You don't want to be spreading disease out there, okay? Okay. Do not use breeds or individuals known to have immune deficiency problems. Any dog that's got Demodex you don't want to use. By definition, that dog has an immune problem. Why use it? You don't want a dog that has Ascarid's, because they shut down the immune system also, okay? But this is Newcastle's disease virus. This happens to be a Lesotho strain. Why that one? Because that's the one the chicken place that we bought the vaccine from had. It seems to work very well, okay?
It's
What was
easy
the
to get
cost?
to.
Box of 6 costs us about $10, so you're talking about $2 a bottle.
Yeah.
Comes with 20 cc's of diluent, usually 1,000 virus particles in these things. We usually made it up with 6 cc's of diluent, threw the rest of the diluent away. Why? Because it was how much the bottle held. The bottle holds about 6 cc's, okay? So please understand, this was back in the early days. We didn't even understand what the hell we were doing. We didn't understand the immune system. It was totally out of our understanding. Certainly nobody else knew anything about it, okay? This is 1970, 1969 we were doing this. Okay, so that's basically what you use. And there are several sources which we have in the files now. And you can buy this stuff overnight in the United States and have it shipped to you. Okay, so we place an IV catheter in the dog. We inject 2 to 3 cc's in about a 100-pound dog. Why that much? Because that worked pretty well for us. Remember, it's all a priori, just what we've developed. Do not use any corticosteroids. Why? Because that interferes with your immune system. You can have a copy of this. I'll pop this out and give it to you on a disc, okay? I would have given it to him, but it wouldn't go through the emails.
Oh.
Okay, so there's our surgery. We recommend that you do it as thoroughly as possible. The bottles were given to us by the local lab. Those are 20 cc syringes sitting on the table with 18-gauge needles. They have a, it looks like a splint laying out there. That's a table we put them on their backs to stabilize them. And the dog is, of course, anesthetized. And timing is essential. Timing is everything when you're dealing with immune materials in the body. If you stimulate it with a virus and you pull it off at 6 to 8 hours, you are pulling off interferon. Interferon does not cure distemper. Okay? Does not cure distemper. Under these circumstances, you're making alpha, beta, or gamma. All 3 at once. If you do this in vitro, you're only making whatever that cell makes. And neutrophils make alpha, fibroblasts make beta, and I forget what the third cell is to make gamma, I can't remember. But in humans now, what they're doing with this material is they're making it in vitro, so they're making a bullet, they're making a 22 What you want is a shotgun. This is a shotgun, okay? 11 to 12 hours post-injection. Put the dog to sleep, get an IV running on them, shave their necks, and what we did was put an IV catheter. This is a jugular catheter. Why did we use that? Because you could pull a lot of blood quickly out of this dog. If you try to do it out of the cephalic vein, you get really slow as you start to get the blood out. It takes you almost 45 minutes to do this. You can do this in about 15 minutes. And so on the one line you're giving fluids, on the other line you're pulling blood, and you pull blood until the dog looks like it's going to go into shock. Okay, you get as much out of the dog as you can because you only get one shot at this. So place the jugular catheter. 11 to 12 hours after you've given this the vaccine. Second time around you can't use it because you have antibodies then, and antibodies block what you're trying to do. These Newcastle disease antibodies are useless for any treatment. They don't do anything, okay? Then you take blood, 20 cc syringes. It's immediately put into bottles, okay? 10 cc vials, sterile, no additive, nothing, just spin down bottles. And you can, the lab usually will give them to you. Allow the blood to clot. Now in the dog it takes about 30 minutes, in a cat it takes about 10 minutes. And in the cat, if you don't take the blood off immediately, what happens is the red cells begin to lyse, and then you have hemoglobin in there, which you really don't want. So you want it clear. So as soon as it clots, immediately after clotting, spin it down. You want to get the red cells out of there. Why do you want to get the red cells out? Because if you give red cells to a dog that doesn't have the same blood type, they're going to get a reaction. If you use serum, there's no reaction. Species to the same species is critical. Okay, that's what it looks like when you take it out. We've pulled the serum off, red cells are left behind. It's put into bottles like that, which are sterile, 10 cc bottles, okay? When you refrigerate this, there are very large proteins in that serum. They're called cryoprecipitates. They make absolutely no difference. You can leave them in there, you can filter them out. We found over time that it made no difference, but there are white precipitates at the bottom, which you can see. And if you shake the bottle, basically what will happen is it'll sort of make the serum cloudy. So you can clear it. So a 0.2 filter micron, you can take it and you can essentially pull the stuff out and leave the cryoprecipitates beside. They're not the immune problem you're looking for. That's not what's there. Okay, this is how we stored this stuff. This is the crisper in a refrigerator. These are the bottles in baggies. Make sure the tops have got alcoholed off so that they're clean. You don't have any blood left, or you're going to get, secondary mold and stuff on them. You got to be careful of that. But then you just stick them in baggies and put them in the refrigerator. We use stuff 5 years old and had every bit of the control that the original stuff did. So it's good for, as we feel, up to 5 years, probably longer. Somewhere along the way I read you could freeze this stuff and it's good for 30 years. Go figure. I never froze any of this. We kept it this way in a crisper, in a refrigerator. Okay, how do you treat them? Sick dog. You want to get them before the 6th day if possible. If you get them before the 6th day, they're easy to treat. Here's the treatment. Weigh the dog, 1 to 10 pounds. You give 1 cc of the material plus 1 cc for the dog 3 times. Give it 12 hours apart, 3 treatments. By the time you gave the 3rd treatment, they were already well. You could probably get away with 1 treatment, but we used 3. Don't ask me why we used 3, that's just what we set up. It was the way it was. You could probably do it with 1. What is amazing is, look at the amount of material you're talking about. You got a 10-pound dog, you're giving it a cc of this material, which is nothing. Cc of Coca-Cola wouldn't even wet your whistle. And that is enough to set off whatever the immune stuff that's in this stuff to do to get into the dog and trigger all the cells that are necessary to kill the virus intracellularly. Now, I say that to people that have medical training, and they say, oh, come on, that's not possible. There it is. You're looking at it. It does, it works. And this is what we did for the first 3 or 4 or 5 years. Until finally people would write to us and say, how do we get the serum? Well, in the meantime, we had a problem. The FDA came along and it said, we're not going to allow veterinarians to ship serum for anything except blood expansion. Any serum that is shipped to treat a disease in the United States is illegal, and it is to be subject to a fine and jail time, period. So we stopped shipping serum to anybody. You could come to the clinic and we would treat you, but we could not ship the serum out. I didn't want to spend time in jail. Didn't make any sense to me, but that was the ruling. And so we stopped shipping serum, period, okay? So about that time, we realized that you got a problem. What do you do with somebody, say, in France, you can't ship serum, or somebody in Texas, you can't ship serum? Why don't we try just shooting the dog with the NDV straight? All right, well, here's the problem. Distemper can cause immune failure. That's why you have the disease in the first place. It got in around the disease, around the problem. So if you have a dog that has immune failure, you hit it with NDV, it doesn't make the materials that are necessary, it doesn't clear the disease. Conversely, you got a dog with Demodex, we know that dog's immunodeficient. You hit it with NDV and nothing happens. Dies of distemper. Didn't work. You get other dogs that have genetic problems, combined immunodeficiency problems, you can't treat those dogs. You also really can't treat a dog that's less than puberty, because they haven't gotten to the point where their full T-cell system is developed until they go through puberty. Okay, so here we are. Doesn't treat parvo. We bathed dogs in parvo with this stuff. I mean, we gave them hundreds of cc's and had no effect, okay? Okay, so where are we here? Here's a dog. That dog that's day one, hour one, distemper case. How do we identify this? What is this? How do we know that's distemper and not herpes? Okay, that became the major test. If you send the serum to the lab, it takes 2 to 3 to 5 days to get the answer back. Now you're into day 6, 7 already. Too late to treat. So what have you done in the meantime? You gave him antibiotics, you gave him fluids. Is he still sick? Yeah, he's still sick. Okay? Or you get a conjunctival smear, you send it in for IFA. How long does that take? 3 to 4 days. Dog's still sick. Now you're up to day 4, 5, or 6 again. So again, you're pushing the limits of what your stuff can do. So we stopped and looked at this and tried to figure out how we could handle this. And what we decided was, 1, you pull the blood from the dog to send to the lab. Then you immediately treat the dog. Treat the dog immediately, because if you're wrong, it doesn't make any difference. If you're right, by tomorrow the dog's well. That makes sense. Doesn't cause any harm, and yet it clears the dog. And if it's one of the other viruses and it doesn't do anything, so what? Okay? Now, you need to know whether you have distemper or not. And what we realized was there are several areas where the distemper virus is always found. It's usually found in the conjunctiva. It's almost always found in the macrophages in the lung, but you've got to get that out, and it's hard to do. But there's an easy place to look, and that's in the bladder. The transitional cells in the bladder are highly sensitive and highly reactive to the virus. They always have the virus. So if you have distemper in the acute phase, and you pull cells out of the bladder, which is as easy as passing a catheter, drain the urine out, run it back and forth against the bladder wall, get some cells loose, suck them up into the catheter, bring them out, put them on a slide, dry it, stain them with Diff-Quick, which is every veterinary hospital's got Diff-Quick. The cells with the virus will have red inclusions alongside the nucleus, 80–90% of them. Easy to diagnose. If they're not there, it's not distemper. Easy. If they're there, it's distemper. Come on, what could be easier than that? It's a 10-minute test, 20-minute test, 15-minute test. Simple, fast, yes or no. Okay, in the meantime, you sent the stuff to the lab. Now you've treated the dog, okay? If he had inclusions, tomorrow he's better. If he didn't have inclusions, is he better or not? Yes.
Does that show up before anything else, those inclusions, like before a discharge from the nose or the eyes?
They show up from the very first minute you see any clinical symptoms, and they last about 10 days in the bladder. After that, they sort of tend to start to disappear.
You've got a dog, comes to you, diagnosed with distemper, having seizures. What do you do? Take us through it step by step.
The sooner you treat it, the better chance you have of control. If you wait till later and there's enough damage, the dog's going to die regardless. You've got 4 kinds. The one coming up the backbone You got to do it pretty quick, because once it reaches up into the thoracic area, it turns off the ability to breathe, and you're not going to do anything to save that dog. The optic neuritis, it turns out it treats it really quickly. We're talking sometimes less than a week. These dogs go back to being sighted, and I find that extraordinary, okay? The seizuring dogs, I think it would take a little bit longer. The ones that we treated in Indonesia, the seizuring dog was also blind. It regained its eyesight within a matter of a week or so. The seizuring took about 4 to 6 weeks to come under control. The dog with chorea, I'm trying to think of the amount of time. I think it was 4 to 6 weeks also, and the chorea stopped on that dog. And that dog was paralyzed in the hind legs when we treated. It could not walk, okay, and it did walk. The dog we treated there could not walk, could not see, was sighted and walking within a matter of 2 weeks, the one we treated in UCLA.
Mhm.
So that's been documented but never printed, never published. If you have a dog with seizures and you suspect that you're dealing with distemper, remember that list I showed you?
Right.
Because it could be any of those things. You want to tap the brain, you want to give it an anesthetic, prep it for surgery. You want to tap the brain, and you do that by doing it through the foramen magnum, and you want to pull some of that material off. You want to get some. Then you take the same needle, leave it where it is, and you put in about a half a cc, depending on the size of the dog, of active NDV virus into the brain. Then you follow it with a flush of saline. Why that? So that essentially you flush the needle and you get it all in there, because the needle's going to have about probably 2/10 of a cc stuck in it, and you don't want it left in the needle, okay? Now, I had somebody write to me and say they made the NDV up with saline rather than the distilled water, and they didn't get any seizures. My experience is that every time you put NDV into a dog, you're going to get seizures, okay? So you need to have a catheter into them for fluids, and you need to have them anesthetized when you do it, okay? But this individual wrote to me and said, we gave it with saline mixed with the NDV. It worked just as well, and we didn't have any secondary effects from it, okay? So yeah, I would do it that way.
Talking about putting the needle into the spinal canal.
Spinal canal, yes,
Right.
not the spinal cord, but
Right.
the canal.
Big concern is whether or not you might nick the spinal cord.
Yeah, that's called pithing. Yeah.
Right. Now,
Yeah,
do you
right.
need
So
to
somebody
use,
that knows how to do that needs to do it.
right. Do they need to use ultrasound, or can they just, do they need to use an ultrasound to guide the needle, or can it be done
No,
without
I
it?
did it without an ultrasound for years without a problem, because I also did spinal surgery. Okay, we drop needles in, and you can close your eyes, and you got the dog in position. You got your fingers on it, and you got the needle right where you want it, and you can feel your way down the bone. And you pop right through there's a thick membrane there. You can feel it pop right through that, and you don't need to go any further. You're there, and then what happens is the fluid comes up through the needle. Okay, so we would put a catheter on the needle and pull the fluid off.
Mhm.
Okay, because that way you didn't bother the needle. Then we would pull the catheter out and inject the NDV into the needle. Now, 2/10 of it's stuck in the needle, okay? Probably 1/10 because you're using a very tiny needle. Then flush it with a little saline, then just pull the needle out. I mean, the whole thing takes 5 minutes, 2 minutes.
Okay.
The trick is to walk it down.
So it's like
and
a
feel it
spinal
pop.
tap, but up in the brain area.
What's
It's like a spinal tap.
It is a
but
spinal tap.
But in the brain
It is a
area.
spinal tap. It's exactly
So
what it
that
is.
pop that you
Now,
feel with the
I've had
spinal-
some people that weren't quite as adept injure the neural cord, and the dog had trouble walking for, just cut his legs off, literally. And then I had another case where the dog had been in the field with cows, and so it had cow shit all over it, and apparently the guy didn't clip it and prep it for surgery, and they got tetanus from putting the needle in. So the dog had tetanus, okay? So he says, just NDV caused tetanus. No, it doesn't. But that doesn't mean you can't get tetanus when you don't do it cleanly. It requires that you do this in a surgical manner.